Today we will tackle the topic on pain management. I have with me the only pain specialist in town. He's an anesthesiologist by profession and a pain specialist by vocation, Dr. Francis Jason Villegas. I call him Jason. Hi, Doc.
Hi, man.
So tell me about pain. Um, when did you decide to specialize in pain management?
Well, I thought of it as when I was under training for my residency in anesthesiology, I thought that I could spend more time with patients because as an anesthesiologist, usually you do things within the perioperative period. Perioperative meaning you see the patients prior to the operation, during the operation, and after the operation. And if the patient is fortunate enough that if they don't have to undergo surgery again, you might not see that patient again. But as a pain specialist, you tend to have constant relationship with these patients on a longer period. And the impact that you can instill on these patients' lives would be more significant, as I would see it.
Okay, so we're talking now about pain management. How is it similar to palliative treatment? Or are they different terms?
It becomes, palliative medicine, by the way, covers a bigger umbrella of the symptomatology of a patient undergoing cancer. So one of the foremost subjects in palliative medicine is pain, by the way. But there are a lot of other symptomatologies that is handled by a palliative doctor. So one of them is pain. There are other symptoms like nausea, vomiting, sleeplessness, even wound care is covered by that.
Okay, so let's go back to real life. You talk about pain. If I have a headache or if I have my dysmenorrhea, usually my family doctor would just say, take this or take that. Or me, an MD, murag doctor, I self-medicate because I normally know what to take for my headache. Should I have gone to see you or should I have just gone to see my own family doctor?
Okay, that's a very nice question because for me, a doctor should know the basics of pain management. And of course, we cannot help without practicing self-medication too, for as long as you're within the domain of practicing correct medicine. But if you think you're not sure about it, you have to seek the help of a doctor. For a simple headache, not necessarily that you have to go to a pain specialist. There are other doctors who handle pain, by the way. I can name a few. There is a neurologist who specializes in headaches, vascular headache. Not only that, your rheumatologist handles joint pains, and we have physical rehabilitation doctors or rehab doctors who handles recovery from injuries like stroke and the likes, of course.
So when do we see you?
It becomes my specialty. I would like to convey this message to the public that my specialty, by the way, is a referral specialty. So when the pain becomes so bad that your doctor, or it seems like, because the usual practice of some of the patients is they see one doctor, and if they don't get good relief, they see another doctor. But sometimes we have to credit treatment by seeing the doctor on a follow-up basis. But if you are the type of person who jumps from one doctor to another, and you end up having a mismanaged form of pain, because chances are from one doctor you get this type of medicine, from another doctor you get another. So I come in because I would like to see what were the medications taken, and then I sort of manage and then give the proper medication that suits you. And I would properly instruct the patient what's the proper timing of the medication and what are the expected responses. And if you don't get a response, you have to follow up and come back.
So you're
I think that's
saying
most important.
referrals. Which doctors usually refer to you, or let me rephrase it. What cases are referred to you for pain management?
in most cases, the pain special as a specialty gets a bulk of their patient, like 70% of the time, from oncology. Oncology being the medical oncologist or the cancer specialist.
Okay.
Because